A new mom was losing weight fast. Her heart raced, she felt waves of panic. Her doctor congratulated her on losing the baby weight and offered her a pill for anxiety. And yet, her anxiety was doing its job. It was a message from her thyroid. Welcome to this episode of the Biology of Trauma podcast. I'm your host, Dr. Aimie. This is part 2 of the conversation with Dr. Nicole Cain, a naturopathic physician with a master's in clinical psychology, where we are walking through the last 6 of the 9 systems that can create anxiety. You will learn how the nervous system itself produces anxiety and how hormones and immune cells do the same. You will hear why anger rises as you come out of a chronic functional freeze, and you will hear how trauma work shifted one woman's biology down to what showed up on objective testing. If you missed part 1, we covered chest, gut, and thought anxiety, and the link for that is in the show notes. Let's jump in. Now, you also bring in nervous system anxiety, and the way that you describe that sounds familiar to how I describe something like what we call global high intensity activation, where it's just the overall physiological state that just has you on high activation all the time. And it doesn't take much to then tip you into that panic and that paralysis and that shutdown. So how do you describe and define nervous system anxiety that's different than these other categories of anxiety?
For the checklist is, do you have any feelings of numbness or tingling? Some people worry, oh my goodness, I can't feel my nose or my face or my lips or my fingers. Am I having a stroke? And of course, go to the doctor and get a good exam, but it could also be nervous system just talking to you, giving you data. Nervous system anxiety can show up with pain. I had a patient years ago who, when she would experience nervous system anxiety, it would present as a conversion disorder. And so when she panicked, she would lose her vision temporarily. And that could be quite terrifying. And then we get fear of the fear, and then it starts to feed back into itself. But if we can start to recognize, like, okay, this is my nervous system talking, it's not pleasant, but I can practice holding space for this. That's what can help us get better. Other things on the checklist might be your shoulders shrug higher and higher, and you can't reach your toes because your muscles are so stiff, or perhaps you get headaches. These are all signs that it might be time to tend to the nervous system. My favorite, I love throwing in herbs because I just think they're so wonderful. My favorite for the nervous system is a tropho-restorative herb, and that's the tonifying weak and damaged systems. It helps nourish the nervous system. It's called Avena sativa. And I find that is very gentle, supportive, and it's really good for people whose nervous systems have been quite fried by chronic stress, or even from medications, like those who have a history of benzodiazepine as a coping strategy for panic and anxiety. Is supporting and tonifying and nourishing the nervous system.
Yeah, the nervous system really is the driver of our state, the whole state. So tone and tend to the nervous system.
Yeah.
Your next category is one that I have loved leaning more into lately, and that's the endocrine or the hormone anxiety.
Yeah.
And I have loved watching more information come out in the last few years on menopause and perimenopause, especially as it relates to its effect on not just our mood, but our sense of capacity in our nervous system. So let's talk through the endocrine and the hormone anxiety and how someone would recognize that that might be their reason.
Whenever we go to the doctor, every year we should ask for basic blood work, just to make sure that the body is healthy, that everything is supported as it should be. And if anything is new or different, if you have a new onset of symptoms, even if you had your blood work done recently, things are different. Check it again. And I think about Charlotte, who I wrote about in Panic Proof, who had 2 babies. And she was in that 6-month postpartum window. She'd had her labs done at the hospital. And then within 6 months, she started to lose weight rapidly. She started to experience heart palpitations, heat intolerance, and a lot of panic and anxiety. And the doctor was like, "Look at you, baby weight's coming off. How lucky. I'll give you a benzo and everything should work out. You'll feel better." And she didn't. Then she just felt all of those things plus feeling like a zombie. And so she was my friend. And so I was like, go get a second opinion. I think you should get your hormones checked. I think you should get an endocrine check. It turns out she had Graves. She had hyperthyroidism in Graves, which a benzo doesn't treat. You have to treat the thyroid. And so when in doubt, basic blood work, and that would be at minimum a full thyroid panel. I would also look at sex hormones if there are new symptoms that are coming up. So even for both cisgender men and women, we want to look at estrogen, progesterone, testosterone, and the other complementary hormones. We can also look at cortisol. We can look at adrenals. We can look at hormone metabolites. What's also interesting about the endocrine system is if the endocrine system is out of balance, we always want to ask, well, why is the endocrine system out of balance? What's underneath of that? Is it environmental toxins? Is it I have a genetic SNP where like a COMT SNP? We always want to go deeper and deeper and see what this is an adaptation to. And so for endocrine anxiety is ask the question, could it be the endocrine system? And then if so, ask why and treat the why.
Yeah, I think of our toxic world and all of the endocrine disruptors that we are exposed to every single day. So for those of you listening that you may not know this, the receipts that you get at a store contain so many endocrine disruptors that it would be best just to not ever touch another receipt in your life. And yet, how much of that is still a common practice in our world? So just the endocrine disruptors in our toxic world can be a reason for people to look at and just find ways to reduce your exposures. And then notice a difference in your mood and in your anxiety level.
Yeah.
Not too far off from that is the immune system.
Mm-hmm.
And wow, have I seen this come to play, whether it is anxiety during an infection, after an infection, for those with autoimmunity, where your immune cells are attacking your own system and cells. So let's go into the immune system anxiety and help people understand this one.
Your immune system is part of how our body responds to stress. When there's danger, the body will recruit our mast cells to degranulate, and it is an important part of that arousal. It's an important part of being safe. For example, have you ever encountered anybody who gets flushed when they get anxious or they get itchy, or maybe when they have allergies, they're having a harder time sleeping? They notice, not only am I dealing with itchy, watery eyes and a runny, congested nose and a cough and a scratchy throat, but now I'm an insomniac. And that's why some people feel less anxiety when they take a Benadryl or hydroxyzine, is because it could be immune system related. And the question is, well, why is my immune system talking? Why might my immune system be driving this behavior in my body? And we see so much of this, especially in a post-COVID world where we have different kinds of inflammation that we haven't seen in the human population. A lot of people are experiencing spike protein accumulation, and spike proteins can be pro-inflammatory. We see more microglia inflammation. You mentioned that, microglia, the immune system, cells in the brain. And neuroinflammation is the central part of the conversation when we're recording this in 2026, is when in doubt, get inflammation down, get to the root cause of inflammation. Immune system anxiety, if you have any signs of that, of course, start with the basics. Like you said, is what might be some of my obstacles to cure? Do I handle receipts for a living? Am I in a bank? What might be my obstacles to cure? Am I microwaving plastic? Do I work for Dow Chemical? Sorry, Dow. Start thinking about, do I get my hair dyed frequently? Could I switch to something like henna? What are my genetics? Am I an effective detoxer of some of these, estrogens? And start supporting your immune system, because that, I think, for most people will be profoundly helpful for panic.
I see the mast cells as so critical to the nervous system, and thus still having the footprint of unresolved stored trauma. And so when I see histamine responses, it makes perfect sense for the people that are coming to me for help. And it's not common that people have been told, that you have mast cells and that they will become overreactive, and that the chemical that they release, histamine, is also a neurotransmitter. So a brain chemical that creates anxiety, and partly due to the increase in adrenaline that it creates. So for those who've read the biology trauma book, you're going to be looking at Claire's story, because the histamine response in the mast cells was a big part of her story as why she was then stuck in this body trauma loop and her immune system and these mast cells. So between the activated microglia in our brain and these overreactive mast cells, the immune system I see as one of the major systems that need repair from unresolved stored trauma.
Mm-hmm. That's brilliant. I want to echo that too. And the oral microbiome is a big source of immune system fortitude. So if you have a history of gingivitis, periodontitis, if your gums bleed when you floss them, we've seen in the research that the immune system cells from the microbes themselves, that the immune system cells respond to the microbes that can cross into the blood-brain barrier. The microbes themselves can also cross the blood-brain barrier. The microbes in the mouth's metabolites can cross the blood-brain barrier. So really look at the health of the gums and the teeth, and go to the dentist. If your patient is suffering from anxiety, send them over to their dentist.
I mean, we really are talking about a whole body health system here, where it's not possible to separate what you would consider your mood and your mental health from your physical health and the health of your teeth and your gums. And I know that this is how you were trained, and yet this is not still the majority of what people are being taught. They're still being sent to their therapist or psychiatrist for anxiety, and not their primary provider or a functional medicine provider who can look at it in this type of holistic way, and literally head to toe, gums to your blood flow and these other systems that we know will be a part of it. The last three categories would be ones that I think most people would look at and be like, oh yeah, these are more emotional ones. Be curious what you say and how you describe them. Let's start with the depressive anxiety. You mentioned that earlier. What else can you say about the depressive anxiety that will help people relate to that one and know, this is maybe what I'm dealing with?
I think about when we treat depression, we can often inadvertently cause a domino of other symptoms. So, for example, somebody will go to the doctor. Let's say that they're very, very anxious, and the doctor gives them an SSRI like Zoloft. And what's interesting about Zoloft and SSRIs is that they share an enzyme that dopamine metabolism uses. And so when we force the serotonin pathway to make more and more bioavailable serotonin, is we can end up with low dopamine. And dopamine is that feel-good neurotransmitter. And so we get a black box warning of someone may be more motivated, maybe a little bit more alert, but they don't have any feel-good. And so then we have an increased risk of suicidality. So anxiety and depression go hand in hand. The gut microbiome that influences cortisol, that influences dopamine metabolism. Many of these microbes also influence serotonin metabolism. So signs that you may be dealing with depressive anxiety, you want to look for feelings of despair. You want to look for low self-esteem, some of those thought anxiety, that negative self-talk. And we want to look at where that originated. We want to go down the timeline and try to figure out what that was an adaptation to. Is that an adaptation to something that did happen? Or was that an adaptation to something that should have happened but did not? And then identify the ways to try to meet those needs. And when we talk about an adaptation with depression especially, is that the body loves homeostasis. And so if I need to be in this low depressed state, my gut's like, okay, we're gonna get into a state to support this. My immune system's like, okay, done. We're gonna get into a state to support this. My nervous system's like, okay, we got you. We're gonna try to keep this homeostatic state in. So then when we try to push that out of balance, then all of these symptoms can come up. So when we're dealing with depression, think of depression as a multi-systemic condition with lots of different layers, and always, when in doubt, get to the root of when it all began.
Yes, I love that. Get to the root of where it all began. And how I've kind of put that in my framework is depression is always in that low energy, what I would call trauma biology. You're no longer in that high energy stress response. You have crossed the line. And what you're saying is that let's go find why we crossed the line. When did things become overwhelming? Why did they become overwhelming? Because until we find the root, we're just going to be masking symptoms. Nothing's actually going to change. Nothing's actually going to tell the body, oh, we don't need to be in this low energy trauma state of depression anymore. It will stay there until the original messages have said, okay, we're good. We've had our repair. We've had our resources. We're now ready to come back and be fully alive and have that vitality that we're intended to do. So similar then, we have the anger anxiety. And this is that high energy anxiety. And you're still running on an emotion that is energizing you. And so it surfaces as irritability, restlessness, anger. So tell us about that one. I'm not sure if we need any further description because I think people are already like, yep, I've been there before. I know what that feels like.
Yeah.
But I think the same thing, you're going to say the same thing, right? Like is find the root of it. Find the root of it.
Yes. And that's the fight part of fight, flight, freeze is you don't have an anger problem. This is likely autonomic arousal to something. And a couple of tips for anger anxiety is you almost always want to cool the system. So if in our bodies, again, we want to lean into homeostasis. So if our homeostasis is that fight protective mode, the body's going to crave whatever will help it stay there. And so oftentimes I see people craving hot drinks, spicy foods, and that's very likely going to make it worse. And so we can soothe the body with cooling drinks like popsicles, ice water, something like a bubbly, effervescent, cooling spices like peppermint or fennel or wintergreen. Avoid really hot, spicy things. And instead of doing heavy, warm vinyasa yoga, go and swim in a pool. Things that will slow the body down, cool the body down, calm the body down.
Yeah. And let me remind people that as you come out of a chronic functional freeze, so those chronic states of stored trauma, you will experience anger. And that is normal. That is natural. That is actually healthy. That is your way back home to parasympathetic, to calm alive, is that you are going to be going through the survival anger that puts you into overwhelm and puts you into the freeze and shut down. We are naturally going to feel angry at those things that threaten our life. How dare you scare me like that is the type of anger that is very normal. And that does not go away just because you went into a freeze and a shutdown. It is still waiting for you. And as you come out, you will experience more anxiety, more anger. This is where you may start initially, you had better sleep, and then you reach a phase where you're having less sleep and you're feeling more of that energy. That's normal. This is just opening up these pockets of stored trauma. So speaking of stored trauma, the last category for you is what you call trauma anxiety.
Yeah.
How do you describe this?
We often heal like an onion. And so we pull off those outside layers of the onion to see what's on the inside. And sometimes we can go straight to the center of the onion. Oftentimes, I find that we have to gently work through it layer by layer. And a really interesting concrete example of that, I write about Esme. And Esme was dealing with panic and anxiety because that's who comes to see me. But she also had really terrible polycystic ovarian syndrome. And she called her uterus the sadistic organ that was out to get her. She's very funny and quirky about it, but she suffered quite a lot. And she had done the typical antidepressant. She'd done birth control. She'd done all of the dietary things. She did everything right. And what ended up being the opening piece of the puzzle for her was looking at the trauma. And so we rewind again down the timeline, and the symptoms began when she was a little girl. And there was a specific memory where her father came into the house, scared her. He didn't probably intend to scare her, but she started screaming. And in a fit of rage, he ended up kicking her right in the gut. And her symptoms started with lots of stomach upset, and then it's held onto it. The body held onto it to remind her, we can't do that. We're not safe. And so she started to develop menstrual irregularities and polycystic ovarian symptoms. And it was the EMDR treating that trauma, unpacking that beginning of the onion forming, is what actually helped clear her PCOS, which is so cool because EMDR shows us that doing trauma work can actually help the body repattern its endocrine system, its immune system. Our lived experience can get better, and we can see it on objective testing. So trauma, really all of these things we're talking about, I would argue it's like your work, the biology of trauma, like really all of this is trauma. But I parsed it out as a separate 9 type because you want to start there if that's the main thing showing up. If someone comes into your office and they're losing weight rapidly and they have heat intolerance and we think it's endocrine, address that acute concern first. But if somebody presents to your office, or a loved one, if you're not a clinician and it's a loved one, and they have nightmares or flashbacks or intuitive thoughts, or they're avoiding a certain place or person or situation, then doing the trauma work first might be a really valuable place to go for this one.
Yeah, and I think of the different people and practitioners represented in this audience, and it's a mixed group. And so looking at those who are traditionally trained in more mental health approaches, and they're more doing the therapy, coaching, counseling type of work, and they're looking at this biology thing being like, I don't want to touch it. Like I intentionally did not go to medical school for a reason. I don't like it. I don't want to touch it. And being able to just step back and say, you don't need to. And yet, what if you had a piece of paper, a page, that someone comes into you and they report anxiety, and you are still going to do your primary modality that you're trained in, that you're excellent at, that you're very competent in, and you give them this education of, you can look at these things, because the way that the body gets stuck is, as we've mentioned, there are obstacles to healing. And so it's never going to be just one thing. It's always going to be a combination of, in my world, right? Like something related to the mind and the thoughts and the beliefs that you hold about yourself and the somatic memories that you have, maybe of getting kicked in the gut. So there's somatic implicit memories that need to be worked through and uncoupled. And then there will always be a biology piece. And maybe that biology piece isn't, oh my goodness, you have Hashimoto's or you have Graves' disease or something to that degree. But what if it's just you have a nutrient deficiency? What if you have zinc deficiency? You're literally fighting your own biology as you're trying to say, come on, let's heal this. Let's have the energy to do the healing process. And your body is looking at your cells and saying, would love to, but we need some magnesium first. We need the nutrients to show up for you in the way that you want us to heal our past and our patterns. So being able to provide that education, I think, is the practitioner of the future. Someone who is still focused on their modality and has that holistic view that they still then provide education on the piece that they're not trained in so that the people coming to them still get that information and don't have to go searching and being lost for years without that. So whatever you are, whoever you are, whatever your gap is, just that would be my recommendation is fill in the gap with some educational information, PDFs, documents, a guide that you can give them so that they can then have some direction for, oh, let me go to my doctor and let me ask for that basic lab panel that I haven't asked for in 5 years. And them doing that will support the work that you're doing with them. And that's very encouraging. I would think that for both of us, Nicole, right? We wouldn't be doing what we do. We wouldn't be teaching what we teach if we didn't have a huge sense of hope and possibility. And I've heard you speak on that, so I know that that really resonates with you. There's so much hope.
Yeah, there is. That's the message I always love to end my conversations with, is that your body is wisely designed to heal. And there is always hope. And if things are feeling sticky and if it's not shifting, it probably means that there's just a little bit more information to find or a little bit of a different approach. I think about how in tarot, there's the Fool's card, which you turn yourself upside down and you look at things from a different perspective. Is if you're trying the same thing, try something different. There's always hope. There's always possibility. Don't give up on yourself.
And what a wonderful way to end. Thank you. Thank you for your time. Thank you for your expertise. Thank you for sharing so much of your knowledge and experience. Anxiety is a message from a specific system. Now you have the full checklist. 9 places to look: chest, gut, thoughts, nervous system, hormones, immune system, depression, anger, and trauma. When you know which system is speaking, you know what to check. You move from fearing the message to working with it. And as Dr. Cain reminded us, your body is wisely designed to heal. There is always hope. If this conversation gave you a new way to listen to your body, please leave a review. Reviews help more people find these conversations that can help them. Dr. Cain's book, Panic Proof, is linked in the show notes, as is my book, The Biology of Trauma, for the biology underneath these anxiety types. Both parts of this conversation are linked there as well. And if you want to see which pattern is running underneath all of this, I built a short quiz to help you see what pattern of stored trauma is your primary. It can be found at biologyoftrauma.com/quiz, and it takes about 2 minutes. Your one job today, the next time anxiety shows up, pause and ask, where is this message coming from? I'm your host, Dr. Aimie. Until next episode, lots of love.